Hello, my name is Joe Ebner, and I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today is Thursday, March 19th, 2020, and I'd like to share with you for a few minutes some of what's going on in the greater Plymouth area regarding COVID-19. I mention today's date because this situation is evolving rapidly, and for the most up-to-date information, I will always direct you to the CDC website or other reputable websites which are updated daily. We are in unprecedented times with the closure of schools, many restaurants, and many workplaces. I understand that many people are very concerned. This is now time to remain calm but vigilant. COVID-19 is a novel or a new coronavirus that emerged out of China in the end of 2019. Over the last 4 months, it has spread worldwide and is now present in all countries around the globe. Your local healthcare community is watching closely and participating with the New Hampshire Department of Health and Human Services, the New Hampshire Public Health Network, for direction on how to best keep you, our community, safe. We have the advantage of being 1 or 2 weeks behind the west coast of the United States. This is helping us to guide our recommendations, our treatments, and our therapies moving forward. Just this week, it was announced that in the state of New Hampshire, we now have community spread. That means people have now been confirmed to have the COVID virus who have not traveled to one of the other countries outside of, or other states outside of our state. This has implications going forward. To date, at Speare Memorial Hospital, there have been no confirmed COVID positive patients. We are fortunate in that we live in a community that does not rely on public transportation or large crowds. This will likely help mitigate some of the disease that we see and space it out over time so that the local medical community can respond appropriately. What has been our response, however? At Speare Memorial Hospital, we have activated our Incident Command Center. We did this last week and we are in our second week. This allows us to get together as a leadership group every couple of days to review the most recent, up-to-date information coming from the Department of Health and Human Services and the CDC, and allow us to implement those changes in the hospital, in the practices, and eventually across our community. We have limited visitors to Speare Memorial Hospital to 1 healthy person per patient. We have also limited the visiting hours, and I will direct you to the Speare Memorial Hospital website for more information about that. You will also notice at the hospital, at every entrance to the hospital, as well as physician practices across town, that we are screening all patients and visitors for signs of illness. We ask for your patience during this process as you're entering these healthcare facilities. It is our first line of defense to keep our healthcare workers and other patients safe. We have also a community-wide response. Many of you may not know that for a number of years, Speare Memorial Hospital, Mid-State Health Center, our local town, university, and first responders have been participating in the New Hampshire Homeland Security and Emergency Management System. We have been preparing for a day such as this for a number of years. Although at the current time, I cannot tell you exactly when and how we will roll out some of the plans we've made, you will know, please be assured that when that time comes, there will be clear direction on what to do. We are working as partners in this to keep our entire community safe. At the current time, if you're having symptoms at home and you feel you are mildly ill, please call your doctor, but plan to stay at home. The purpose of this is to decrease spread to others and to decrease spread to those most valuable in our community, the healthcare providers who will be needed to help care for people with severe illness. It also decreases our resources that might be necessary for those who are critically ill. And thirdly, knowing your COVID status will not change the recommendation for mild disease. If you are feeling severely ill and you feel you need to see your physician, please call your physician's office first so that arrangements can be made for a timely appointment which minimizes risks to others. Of course, if you feel it is an emergency, such as shortness of breath, having a hard time breathing, or a severe temperature, please come to the emergency room where you will be screened and treated promptly. What should you be doing, however, at home? If you are feeling ill and you're at home, the recommendation from the CDC is to self-isolate for at least 7 days from the time the symptoms started and for at least 3 days of recovery from your respiratory symptoms and fever. All symptomatic close contacts of a person suspected of COVID should, for example, your family members, should plan to stay at home for 14 days during this period of time as well. So it's really important that during these times of waiting, that you keep yourself physically and mentally healthy. Physically, I cannot stress enough the importance of getting good sleep, getting a good diet, and getting daily exercise. All of these things can boost your immunity to keep you healthy. I also recommend securing a 30-day supply of all of your medications. We also ask that you implement social distancing measures. What does that mean? First, try to avoid gathering in groups of more than 10 people. Consider greeting each other verbally without handshakes or hugs. And if you do need to go out in public, maintain a 6-foot distance from others, whether it's in waiting rooms or other places where crowds might gather. The other thing to do to keep yourself healthy is to wash your hands frequently, either with hand sanitizer or a 20-second soap and water scrub. Avoid contacts with your eyes, your nose, and your mouth as well. Lastly, when it comes to your physical health, wash down those commonly touched surfaces daily within your home. Things like countertops, handrails, doorknobs, and handles. You can use any of the EPA-approved disinfectants that kill pathogens, including the COVID-19 virus, such as Clorox disinfecting wipes, Lysol brand bleach multi-purpose cleaner, or Purell multi-surface disinfectant. What can you do to stay healthy mentally? Well, I think it's important during these times that we all focus on increasing our mental resilience. Oftentimes, too much social media time leads to anxiety. So please plan on limiting the amount of social media time each day. There should not be any more reason than about once a day to check the sites for the latest updates and the latest news regarding the coronavirus. Spend time outside each day in gratitude for the beautiful day and in gratitude for your current good health. Communing with nature, even if it's from your front porch, is an important part of mental health. Consider adding time of meditation or prayer to your daily routines. Calling on your higher power, your God, to help you ease your anxieties and help you through this difficult time can help many people through times of mental duress. And lastly, engage with your family in books, games, magazines, and puzzles, and maybe consider home projects that you can work on during this time. As humans, we're used to having a routine structure in our day. We're used to getting up and going to work. Kids are used to getting up and going to school. Try to put in your day some of that structure that's going to make it seem a little less unusual that you have everybody home all day long. As I mentioned, the situation is evolving rapidly, and there are lots of changes coming down every 1 or 2 days. And so I do recommend you search reputable websites, which can be obtained through the Mid-State Health Center or Speare Memorial Hospital website, directed to websites such as the CDC. Speare Memorial also has a helpline at 603-238-6464 with up-to-date and current information and the ability to talk to a nurse if needed. Finally, I do know our community to be one that helps each other. And so if you are going to the store and have the ability to shop for an elderly neighbor, you might save her or him from having to go out more than once a week. Consider lending a hand to your neighbors. Consider, if you and they are healthy, babysitting so that those parents can get back to work during these school closures. Lastly, please know that your medical community is keeping on top of this emerging pandemic and preparing for the day when we start seeing more widespread virus around central New Hampshire. Your providers are able and willing to answer questions by phone if you call the office. Stay healthy, and we'll get through this together.